let's drill deeper into this topic of mental health in the workplace. Our guest now, Dr. Katy Kamkar, clinical psychologist at the Work, Stress and Health program at CAMH. It's great to see you.
Thank you so much.
So 1 in 5 Canadians will suffer some kind of mental illness in their lifetime.
Absolutely. So it's really about 1 to 4, 1 to 5 Canadians who will suffer from a mental illness within a 1-year period. So no one is immune to mental health problems. It can affect anyone, regardless of occupation, income, culture. It can really happen to anyone. So no one is immune to mental health problems.
So you said in a 1-year period?
Within a 1-year period, absolutely.
1 in 5 Canadians will have some kind of a clinical problem.
At least 1 in 5 Canadians. I really believe that statistically, the number would actually even be higher. It's just because of the stigma attached to mental illness and people feeling embarrassed and ashamed, they're less likely to seek help.
Well, tell us how the workplace is central when you're trying to address this problem.
Well, we know that aside from home, the workplace is a primary location of the adult life. So work affects our mental health, and our mental health affects our work. So creating and promoting health in the workplace is essential for employees, for employers, and of course our community.
Stress, obviously, stress is arguably stuff that you haven't done, that's undone. But tell us the difference between acute and chronic stress.
That's a very good question, because acute stress is something that we all go through every day within our daily life and also within our job. And actually, a normal level of stress is normal and is adaptive. It helps us to be productive, to meet deadlines. Also, stress is important in situations where we perceive threat or danger. We all have this inbuilt alarm system, this fight and fight response that becomes activated when we see a threat or danger. So stress is very normal and adaptive in all these situations. It's really whenever stress becomes prolonged and overwhelming, so essentially when the stress becomes chronic, this is the one that interferes with our functioning and day-to-day life, and it creates psychological and medical problems.
And we're looking at how, obviously, you can get into a vicious circle here. You start neglecting stuff you're meant to be doing. You might turn to substances, and that just adds to the stress.
Exactly. And that's because of stress affects us cognitively, so it affects our thinking patterns, it affects us emotionally, physically, and also behaviorally. So as you mentioned, we might withdraw, we might engage in more substance use. Yes.
Now, this may seem like a very facile question, but apparently research shows that physical exercise has a dramatic effect on people's general outlook. Do you make a point of prescribing it for patients?
Yes, I do. Absolutely. It has a very healthy component into it. In general, setting up a daily routine, daily structure is very healthy. And a part of that, assigning daily exercise, again, it doesn't have to be an hour, it doesn't have to be 2 hours, but sometimes even 20 minutes, even 10 minutes a day can really be very healthy.
You have some other advice on creating that boundary between the job and work. Can you go into that, please?
Yes, and that's really to help really to create a better, healthier balance between work and our personal life. So to really anything that could help to set up, making the boundaries a bit more clear. So it could be at times as realistic, it could be possible to reduce the number of times we would check the work emails at home. It could be leaving also work at a more decent time. And also making the transition much smoother between work and to home, like for example engaging in a relaxing activity when we arrive home. So all of those kind of activities can really help to set clear boundaries between work and our personal life, and also prioritizing. So really prioritizing our responsibilities, planning ahead, can really help towards feeling less overwhelmed and delegating responsibilities as much as we are able to.
What should employers be doing?
There are various things. Flexible work hours, flexible work conditions can be very helpful in terms of promoting a healthier balance between work and our personal life. Making the roles and responsibilities very clear. Whenever we are assigned high demands or responsibilities, if we have enough resources to cope with the demands, that can again contribute to significant health. And definitely supportive reintegration into work following a leave of absence.
Yeah, because that's going to be tricky. That's going to be horrendous coming back.
Exactly. And as we know, everything is about relationships. So really promoting healthier relationships, supportive work environments. essential.
It's going to be tough, though, for a lot of employees to seek help because there is a stigma.
Exactly. Employee assistance programs, or there are various other resources that organizations can offer: employee assistance program, anger management programs, stress management programs. There are also community resources. It's very important not to suffer in silence and to seek help.
Thank you very much indeed for joining us, Dr. Kamkar.
Thank you very much.
Our guest has been Dr. Katy Kamkar, clinical psychologist at the Work, Stress and Health program at the Centre for Addiction and Mental Health. A lot of good advice there.